Good afternoon, and thank you for joining us for this community briefing on COVID-19. Joining us once again this afternoon is interpreter Margie Propp, and thank you again, Margie, for lending your talents and expertise to this briefing. We encourage everyone to visit our website at covid19.lincoln.ne.gov, where you will find our dashboard with the latest COVID-19 data. We update that dashboard at about 3 p.m. daily, and you will also find our COVID-19 risk dial, a color-coded tool that provides all of you with an indication of the risk of spread of COVID-19 here in Lincoln and Lancaster County. Last Friday, we moved the dial back from mid-orange to low orange, indicating a slight improvement in our local situation. And while that is good news, we still need to be vigilant and be aware that we remain at high risk for spread of COVID-19 here in Lincoln. Today, we lost another member of our community to COVID-19, bringing the death toll in our county to 16. This death was a man in his 70s who had been hospitalized. We offer our sincere condolences to his family and friends. This latest loss in our community reminds us of what's at stake. Our choices in how we manage the pandemic matter to the lives and livelihoods of everyone in Lincoln. The good news is that even without a vaccine, we have the power to prevent the spread and protect our families, friends, and neighbors. Think of the 3 W's. Wear a mask, wash your hands frequently, and watch your distance, keeping at least 6 feet away from others at all times. And in addition to these 3 W's, if you are sick, please stay home. These steps are seemingly simple yet incredibly powerful as we work to contain community spread of COVID-19. These proven public health strategies are vital to our ability to keep each other safe, reopen our schools, and reinvigorate our local businesses and economy. Also today in Lincoln, an additional 32 individuals have tested positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 3,195. Our total recoveries identified to date are up from 1,315 to 1,334. And with that, I will turn it over to Health Director Pat Lopez, who is here with an update.
Thank you, Mayor. As the Mayor said on Friday, our COVID-19 risk dial was moved to low orange. Although the risk of the virus spreading in Lincoln remains high, all key indicators have leveled or improved. In the week ending August 1st, we saw 310 new cases confirmed, down from 361 the week before and 334 the week before that. Today, we are seeing small increases in the number of COVID-19 patients hospitalized from the 19 on Friday to 21 yesterday and 22 today. That includes 11 from Lancaster County and 11 from other communities. We also have 5 individuals on ventilators at this time. Today I want to focus on 3 related tools that we have to prevent the spread of the virus: testing, contact tracing, and finally the process of self-isolation or quarantine. The first step is testing, and we want to remind the public that testing is available in Lancaster County for anyone who wants it, even if they do not have symptoms. The more testing we can complete, the better picture we have of the spread of the virus in the community. You'll find all the latest information on testing on the COVID-19 website. The next step is contact tracing. These investigators have 2 important roles. First, they reach out to all those who test positive to provide guidance for them on how to self-isolate. The latest CDC guidelines call for those with COVID-19 to stay in isolation until these 3 conditions are met. It's been 10 days since the onset of symptoms, and the individual has no fever for at least 24 hours, and all other symptoms have improved. Those who have been tested and are waiting for results also need to stay home until they receive these results to avoid exposing others. And this is really a critical element that we want people to remember. It's also during that time to begin preparing information for the contact tracer in case you're positive. Retrace your steps and write down all of those you've been in contact with. Reaching out to those close contacts of those with the virus is a second important role of the contact tracer. The CDC currently defines a close contact as someone who is within 6 feet of an infected person for at least 15 minutes, starting from 48 hours before the onset of illness until the patient is isolated. Nursing staff starts the process and attempts to reach out to close contacts of positive cases within 24 hours of receiving the lab report. They will also ask close contacts how they are feeling and others that may have been in contact with them. The answers to these questions can help prevent further transmission of the virus. Again, I want to thank all of those who have cooperated with our investigators. Identifying contacts and making sure they do not interact with others is really a very critical piece to reducing further spread. As always, time is of the essence. Self-quarantine is another important element. The contact tracers will provide guidance to the close contacts on how to self-quarantine. If you have a known or potential exposure to a person who has tested positive for COVID-19, you need to take these steps. Stay home and remove yourself from interactions where others could be exposed or infected for 14 days, counting from the most recent exposure, and self-monitor to identify if COVID-19 infection develops. If you have an ill person in your household, you should avoid contact as much as possible, and face coverings should be worn by all. Be sure to wash your hands frequently and clean and disinfect commonly touched surfaces. Even if you do not have COVID-19 and you have been in contact with someone who does, that could change the very next time you go out into public where others are present. That is why we all must continue to limit our interactions with others. All of our educational efforts, recommendations, and restrictions, including the face covering measure, are aimed at preventing spread and keeping our community healthy. If we all follow these reasonable preventive measures, like wearing a mask, we can decrease the chances that we'll see a setback locally, a situation that could lead to the need to implement more restrictions. Remember, this virus is highly contagious. That means the actions of one person can impact the health of many people. I want to thank the vast majority of our local businesses that are working with the health department and implementing the strategies that will help them stay open in ways that keep their patrons safe.
Thank you, Director Lopez. We want to highlight again today for our local businesses that our COVID-19 website does offer a variety of resources. You'll find guidelines for specific businesses, guidance from the state and from the CDC, as well as up-to-date information on loans and other financial assistance that may have become available. We encourage everyone to keep informed of the latest information and resources by visiting covid19.lincoln.ne.gov. We recognize, of course, that this pandemic has posed unprecedented challenges for all of us. And while there are many phases and colors to describe where we are in the pandemic, it's worth noting that we are in an increasingly personal phase. Last week, I learned that a friend's parents had both contracted COVID-19 and are slowly recovering at home. Today, I learned a friend's daughter is in the ICU. I saw someone at City Hall leaving work last week with her computer monitor, having found out that someone else in her household had tested positive for the virus, so she was going to quarantine and work from home. We know that many people and businesses have been suffering for a long time this year, but for others, the pandemic is perhaps feeling closer at hand. Maybe you know someone who is ill. Maybe you know friends or neighbors who have lost their jobs or lost work hours, or maybe you know someone who has died from COVID-19. Yes, the stakes are high, and we have been in this together for so long. I've heard people say that they just want to get back to normal life, and I get that. So let us recognize that we have a role to play in resuming a more normal or more familiar existence. All of us are making choices each day that can either help us or hurt us in pursuit of that desire. Masks are an arrow in our quiver, and we are wise to use them. The virus wants to prey upon us, but we have the power to prevail. As an informed, caring, thoughtful, compassionate community that wants to remain competitive economically and get on that road to recovery, we are greater than this virus when we work together. When we wear our masks, when we wash our hands, when we keep our distance from one another, we are winning. And in the case of a pandemic, winning looks a lot like kindness and caring. When we wear our masks, wash our hands, and keep our distance, we are saying that we care about our family, our friends, our coworkers, and our community. We can only get through this, and we will get through this, by caring about others. Finally, today is another Sunshine Tuesday, and we continue to be grateful to the children of Lincoln and Lancaster County who are creating and sharing their art as part of our Sunshine Kids for Seniors project. Aging Partners is helping children connect with our homebound seniors by sending notes and artwork. Thousands of pieces of art have been shared, and we're so happy to be able to share some of those with you today. If your family would like to participate, please have your child just send in a scanned piece of artwork with only their first names on it, and you can send that to sunshinekids@lincoln.ne.gov. And with that, we'd be happy to open it up to questions from the media.
Riley at the Journal-Star here with the first question.
Hi, Riley.
Hi, I had a question about enforcement of the closure order, and why did the health department decide to go the court route and not have police issue a ticket or arrest the owner at Madsen's for violating the closure order?
I'll have a city attorney come up and speak to that.
Hi, Riley. Will you just repeat your question?
Sure. So why did the city decide to seek an injunction rather than effect an arrest or write a citation for violating the closure order?
Okay. Sure. We have decided to treat this as a civil matter, and we believe that that is the appropriate route to go. The first step is always education. And then if that doesn't work, the next step would be to pursue it civilly, not criminal.
Is there an added sort of punishment if the city is victorious and is there an added punishment to the business in violating sort of a civil injunction, or if they lose in court, is there an extra economic punishment to them than the sort of just regular violation of the DHM?
Well, quite frankly, I think that once we involve the courts and once we go through the court process, that will be a question that will be answered by the court. Ultimately, the court will decide that.
And follow up, somewhat related, have any new closure orders been issued since last Saturday?
No.
Andrew Ozaki from KETV Omaha. Has there been no other complaints, or have you stopped issuing any more closure notices until this issue has been resolved?
I can let Director Lopez speak about complaints, if you'd like.
Hi, Andrew. We are continuing to monitor complaints that come in and provide education. And I believe I mentioned to one of the other reporters yesterday that we've been working really closely, for example, with some of the bars in our community downtown. and are providing some extra guidance and assistance to them at their request. There have been no other orders of closure. I think we've been really consistent all along in saying that we try to provide education, and we certainly want to work with business owners that reach out to us and ask for assistance, and we do offer that as well.
And Pat, can you kind of explain why you guys aren't issuing individual citations or tickets?
Did you say why we are or why we are not?
Why you haven't?
You know, I think we've said all along that we expect people to do the right thing and follow the mandate, and that it's really the responsibility of the businesses to assure that people are following that when they're in their business location. And several of our businesses in Lincoln had already or were in the process of issuing mandated mask wearing. And I think it's really important to remember that this isn't just about mask wearing. There are several other measures involved in here to protect the health and safety of the workers as well as the people coming into the business. We want our businesses to be open. We want them to thrive as much as possible and recover as much as they can.
Any other
Mayor?
questions? Yeah.
Yeah. Is there a possibility that you know you would offer pardons or anything like that? I mean, you know, we have with other people who have protested different types of things. You've offered pardons, but in a case like this, would you offer a pardon to a business that, you know, I guess you really haven't given any citations yet, but you know, is that something that you would step in and review and give a pardon to?
I'll let the city attorney come up. I mean, there's a process for, you know, for people to apply for pardons in general, but I mean, you have to meet certain criteria in order to even be able to do that.
And I just wanted to point out again, and I think one of the first questions was how are we treating these matters? And I think it's important to remember we've already established that we're treating this civilly. A pardon is related to a criminal matter. So when you're talking about pardons, generally speaking, you're talking about a criminal conviction. But the pardon process is you know, after a conviction, you apply for a pardon, it's paperwork, and it gets sent to the mayor's office, and the mayor makes a decision. But again, right now, we're talking about a civil matter versus a criminal matter, as was pointed out earlier. So it's important to remember that distinction as well.
You know, Hansi, just following up on that, is that the sort of trend among municipal governments that have mask mandates or directed health measures, that they're treating it civilly and going to sort of enforce the measures in a civil court and not individually via sort of criminal prosecution?
Well, I think that's a good question, Riley. And to be completely honest, I don't know the exact numbers as to what other jurisdictions are doing. I can't, as I stand here before you right now, I can't tell you, you know, the numbers or percentages of what other cities are doing. But obviously, that is the decision that we have made with respect to how we are going to proceed at this time.
And another follow-up question: why isn't this a person's rights issue and a health issue, as opposed to a health issue?
Why isn't this a rights issue? Is that your question?
Correct. A person's, you know, personal rights to wear a mask or not wear a mask, depending upon their health conditions or their beliefs or anything like that. Why is this different? And why? What line does it cross the point to be a health matter? I guess how is that line drawn?
Well, I mean, I think I would say a couple things to that. The one thing that I would just point out and reiterate again is that we are going through the court process, right? And so I think that in a lot of ways, that particular question I imagine will be talked about in the court process. Also, there is a directed health measure that has been in place, before this, before the state instituted any civil action. Directed health measures have been in place really across the country, and so in a lot of ways, that answers your question. Insofar as the state and across the country, there have been directed health measures, and it has been decided in a lot of ways that this is a health issue.
And what about if it is a health issue? Why aren't you going after individuals as well? It seems like you're picking on just businesses.
Well, I don't know that we're picking on anyone. I would say that what we really want everyone to do is to be safe and follow the directed health measures. In this particular instance, obviously, where there is a case involving a business. But again, the goal of all of this is to have everyone follow the directed health measures and for us to be safe as a community.
Mr. Christie, this is Bill with 1011. For the layman, can you explain tomorrow what will happen at the hearing and whether that temporary injunction could happen immediately after that's over?
So thanks, Bill. What I don't want to do is get into too much specifics with the specific court case. And so I don't want to lay out the exact process for that, because there is obviously an open case pending, but also, quite frankly, a lot of that will depend on the court. The district court will be in a position to really decide the timeline and the consequences and how it will actually play out. And when and how, a lot of that will be decided by the court.
Are there any other questions from the media? We'll just,
Question for Director Lopez.
okay.
Good afternoon, Riley.
Good afternoon, Pat. Just had a question regarding the death rate here in the county. Certainly, another death is very sad. But do you have any sense for where we are in comparison to the state and national average for deaths per number of overall cases, and what may be influencing that in terms of us not having, we're still, just over a dozen here at 16, but certainly Douglas County has far more deaths. But can you speak to maybe what's some of driving that trend?
Riley, we have looked at that some and had discussion, and a lot of that goes back to the measures that we put in place early on from what we learned was happening in other communities and across the country. And it also goes back to the people in our community being really vigilant and being willing to listen and take the precautions to be safe. We've done a lot of work with our long-term care and assisted living, where we know that we've had many individuals who are vulnerable. And I really can't thank them enough for putting measures in place immediately to make sure not only their residents were safe, but in doing everything they could to make sure their staff stayed well. We worked real closely with them to keep their employees well and provide them PPE. And I think that's made a tremendous difference, as well as the fact that we were fortunate to have both of our health systems, Bryan and CHI St. Elizabeth, offer drive-through testing right away in our community, even though testing might have been sparse in other areas. And we also dealt with that, but we were able to get people in right away and get them diagnosed and treated. And so it has made a very big difference for our community and the number of deaths we've had.
Director Lopez, this is Bill. I have a question about the COVID risk dial. I sincerely appreciate all of those metrics that were released last week. When kind of going through all of them, it almost appears that Lincoln is either in the yellow or, even when it comes to hospitalizations, in the green. Can you explain why it is still slightly in the orange?
Well, Bill, that's a good question, but as you said, with hospitalizations are not the only measure that we look at. We're not really looking specifically only at how many people are in the intensive care unit or how many are on ventilators. Our goal in public health is to really prevent that from happening. So that's why you see all the different metrics that are there, and we'd be happy to talk with you offline if you have more questions. I can put you in touch with our epidemiologists and biostatisticians.
I have another question about university classes starting here in a couple weeks. You're going to have 15, 20, 25,000 people in that really age group that's has the highest number of infections right now. What is the county doing at this moment to prepare for that influx?
Well, we're working very closely with the university. Actually, we have calls once or twice a week with them in planning. And so we continue to follow with them, and I think maybe you've seen some of the information they put out from their athletes to encourage mask wearing. We've also talked to them about engineering controls at the university, and both and how they can isolate and quarantine. We have testing arrangements set up with them so that we can test students quickly and isolate and quarantine them. So there's a lot of work going on behind the scenes, and I'm sure they'll be talking more publicly about that as they release more information.
Do you anticipate more positives locally when students come back to class?
Bill, if I had a crystal ball, I could probably say, but I think when we have we have to think when we have more individuals coming into the community from different areas, and we have to remember they may be from areas where there's, we have many counties in our own state that haven't even had a case of COVID. So that's one thing that can happen. We'll have others coming from other areas where there's been more infection and they've quarantined or isolated already before coming here.
Thank you.
But we are concerned. I mean, we're going to be watching and be very vigilant.
Any further questions? All right, well, with that, I just want to reiterate those 3 W's. Wear a mask, wash your hands, and watch your distance. And to remind everyone that we have the power, each of us, to prevail in this pandemic, and together we will. Thank you.